Today, we are delving into a topic that is both deeply personal and highly controversial, and that is assisted dying. In recent news in the UK, a new bill has reignited debates about whether terminally ill adults should have the right to choose how and when they die. In this video, let's explore the pros and the cons and the complexities surrounding the issue. Hi guys, I'm Triya and I am a resident doctor working in London. Right, so let's talk about what's going on in the news at the moment. So in the UK, the assisted dying bill, proposed by MP Kim Leadbeater, could grant terminally ill adults with less than 6 months to live the legal right to die. Under this proposed legislation, requests would require the approval of 2 doctors and a High Court judge. So currently, assisted dying is illegal in the UK, and currently it is punishable with up to 14 years in prison. For some people who are seeking out assisted dying, this means travelling to other countries such as Switzerland, where assisted dying has been legal for over 80 years. So, what are the arguments for and against legalising assisted dying here in the UK? Let's start with the pros. Number 1 is respect for patient autonomy. Autonomy is at the heart of modern healthcare. And autonomy is the idea that patients should have control over their medical decisions. So people in support of assisted dying argue that this autonomy should extend to the choice of how to end one's life when faced with a terminal illness. And number 2 is relief of pain and suffering. So many people, when discussing this bill, talk about how for many patients, pain and suffering, both physical and emotional, can sometimes become unbearable despite the best palliative care. Assisted dying, they argue, is a humane way to end their suffering while also maintaining their dignity. Number 3 is a safe and regulated medical practice. So this argument is that by legalising assisted dying, we can ensure that it's carried out to the best standards, with safeguards such as independent witnesses, checks for coercion, and options to explore all end-of-life care before proceeding. Number 4 is addressing inequality. Critics of the current legislature point out that travelling abroad for assisted dying is only accessible to those who can afford it. You could view this as a privilege, and if you're being really cynical, you could say that this may force some people to end their lives earlier than they'd like, simply because they need to be well enough to travel themselves independently and get to these other countries. And finally, an argument 4 is peace of mind. Even for those people who never use it, the option of having that autonomy and being able to have a legal route into assisted dying may give patients and their families some peace of mind and reassurance. And a big part of the proposal for this bill is to give people that empowerment and that autonomy. On the other hand, the opponents of assisted dying raise several important concerns. Let's go through them now. So number 1 is quality end-of-life care. Some people argue that poor access to good quality end-of-life care, palliative care, and help from social services may drive people to choose assisted dying simply because they don't feel like they have any better options. In an NHS that is well known to be stretched in terms of budget, especially in areas like social care and palliative care, many people argue that it's not right to be focusing on assisted dying before fixing these problems in order to help people live the best lives that they can. Instead, funding and time and effort should be put into improving end-of-life care, including things like palliative medicine and good quality social care, and this will hopefully allow people to spend their last days and weeks of their life comfortable and even in their own homes with the adequate right amount of support and equipment, for example with nurses and doctors who can go out and visit the patient in their own home, or occupational therapists and physiotherapists who can set up their home environment in a way that helps them to carry out their activities of daily living. This obviously requires a lot of resources, for example being able to provide medical assistance, the carers and things like that, and many people who are against this bill argue that that should be the focus rather than assisted dying. What we need is urgent funding and reform of palliative care and social care to make sure that patients have a real choice when they're dying. Also, there is nowhere in the actual bill that clearly mentions that all other avenues and routes to improve end-of-life care should have been exhausted before reaching assisted dying. There is actually nothing about pain and suffering in the bill itself, just the arbitrary number of months left to live, which is 6 months. The next big argument against the assisted dying bill is the risk of coercion. So there's this concern that vulnerable individuals, such as the elderly or people with disabilities, might feel pressured to choose death as they may see themselves as a burden to society or to their own families. And so the people that will be deciding on the bill will be the doctors and the judges, and currently there's not really any good, robust training for judges in recognising coercive and controlling behaviour. And many people argue that the medical training is also lacking in this respect. So for that reason, spotting coercive behaviour itself may be quite hard. Also, in the NHS as it is, you only really get a snapshot into the person's life when you see them. For example, you may see them on a ward round for 10 or 15 minutes once a day, and when you see a patient, at their worst, in a hospital gown, in bed, you don't get an accurate picture of what they're like. You don't get to see what they're like at home, what they're like with their families, and arguably you have very little idea what their actual life is like. It's then difficult to have to ask these doctors and judges and people to be able to weigh in on such huge decisions about someone's life without really knowing them at all. So that brings us on to the next big argument against assisted dying, and that is the slippery slope. So the slippery slope argument is once you start making one thing legal, for example, allowing assisted dying for people who are terminally ill with less than 6 months left to live, then it opens up the floodgates. It could lead to the criteria expanding further and further to a point where it may get out of control. So critics often cite Canada as an example of how assisted dying laws can expand. So the law in Canada was initially restricted to terminally ill adults, but that has expanded to now include people with severe chronic conditions and also coming up mental health conditions. So for some people, this progression in the legislature represents a dangerous slippery slope. Some people go so far as to say that once doctors have started getting involved in the practice of hastening people's deaths or assisted dying, then they've already started their way down this slippery slope. The next argument against is worsening of inequalities. Another big ethical concern is based around the fact that there are more people with poor health from lower socioeconomic backgrounds. As such, assisted dying may disproportionately be seen as a way out. Whether these systemic inequalities may lead to higher usage of assisted dying within certain groups is a hypothesis that needs to be tested over time. And that is why it's so important to look at other countries with similar demographics that have legalized assisted dying for longer. The next argument is the impact on societal attitudes. So some people fear that by legalizing assisted dying, this could change societal attitudes towards the elderly, the disabled, and the terminally ill by suggesting that their lives are less valuable and not worth living. And I think it's really important here to say that palliative care is already surrounded by so much stigma. Often many patients and their families get really afraid and affronted when you mention palliative care to them, because a lot of people associate palliative care with the end of life and death, and they think that when you get the palliative consultants and the palliative team involved, that means that basically you're going to die. And people have these fears even when we explain to them that that's not what we mean, and that the palliative team are the experts when it comes to pain control and symptom control and improving quality of life. So then, can you imagine that when you add assisted dying into the mix, that's going to only further stigmatise palliative care, and it will become even more synonymous with killing people off or a death sentence. And this could end up with people fearing involvement of palliative care at all, leading to worse symptom control and poorer quality of life. We don't want to put up further barriers to care, we want to break them down, make it easier for people to get the care that they need. The next argument against assisted dying is really important and not one that I've seen talked about a lot, and that is the intersection of terminal illness and mental health. So it's well known that people with terminal illnesses, or chronic illnesses, or cancer are much more likely to suffer from mental health conditions, including depression, which means that these people are more likely to be depressed and suicidal as it is. Up to half of all patients with cancer suffer from symptoms of depression, and the elderly also suffer from high rates of depression and suicidality. So mental health illnesses are already so prevalent in the population that is targeted in this assisted dying bill. Currently, there's nothing in the proposed bill that says patients need to go through a mandated assessment with a psychologist or a psychiatrist before they go ahead. So I think that just opens up a can of worms. I think that the whole intersection between mental health and assisted dying is very intricate and complex, and I'm not sure if that's been adequately thought about or represented in this bill as it stands. And finally, a big issue is the doctor-patient relationship and the potential that the assisted dying bill has to impact this. Many, if not most, healthcare professionals feel like their role is to alleviate suffering and not to actively bring about death. Introducing assisted dying could risk undermining the trust between patients and doctors. Currently, seriously ill or terminally ill patients can express their fears about death and dying, secure in the knowledge that the doctors that are treating them will not participate in bringing about their death. If some doctors were then given the power to provide lethal drugs, which gives a patient patient the ability to end their own life, this could seriously undermine the trust in the patient-doctor relationship. Some patients, and potentially the ones that see themselves as a burden already, such as the elderly or the disabled, may already feel like their lives are undervalued, and then may fear that health professionals would just give up on them and give up on their efforts to relieve distress, seeing death as an easy solution. Those were some of the arguments for and against. Let's talk about what's happening in the UK at the moment. So last Friday, on the 29th of November, the House of Commons approved the Terminally Ill Adults Bill that would grant the option of assisted dying to those in England and Wales with a terminal diagnosis and a life expectancy of 6 months or less. That doesn't mean that it's in the law yet. The bill itself will not be brought to MPs again until April of 2025. It will be voted on again by MPs and then go to the House of Lords. And should it become law, there will be a 2-year implementation period. So the debate is far from over. Ultimately, when it comes to thinking about assisted dying and the pros and cons, this debate is about striking a balance between compassion and caution. So it's clear that this is not a simple issue, and there's no right or wrong answer, whether you're for or against it. It is vital to ensure that any law is accompanied by robust safeguards, improved end-of-life care, including palliative care and social care, and a commitment to protecting those people who are the most vulnerable. Okay, so that's all from me. I hope that this has given you a little bit more of an idea. There's obviously not an exhaustive list of all the arguments for and against, and there are lots of really good resources out there if you want to get more information. Thank you so much for watching, and I'll see you in the next video.